for more on where we stand in the vaccinations race, joining us now is Claire Hannan of the Association of Immunization Managers. She's the executive director there. The association's members are immunization program leaders at public health departments across states, territories, and of course large urban areas. Thank you for your time today. Claire, the president has delivered what he said 6 weeks early in terms of his program of delivering 100 million doses in 100 days. We're going to see an upgrade to that target. You are at the pointy end of this process. Talk me through what you think is possible over the next few weeks in terms of upping the numbers of people being vaccinated.
Well, we're at about 2.5 million per day right now. We hit 3 million per day over the weekend. And really, if supply comes through as expected, we could have another 100 million or so, or even more doses by the end of April. So we could be ramping that up a bit. I'm excited to hear what President Biden is going to be pushing us toward. But I think that we could realistically do another 100 million by the end of April, hopefully, or into early May.
Claire, now we have something like a dozen states have opened up vaccinations to anyone over the age of 16. That's well in advance of President Biden's goal of doing that by May 1st. Are those states doing something right that other states should try to replicate, or is it just a matter of population density at the end of the day?
Well, I really think, states are trying to find that sweet balance between filling up every appointment and yet not opening up to everyone to crash the system. So trying to keep the momentum going, the demand going, getting those vaccines into arms as quickly as possible. And it just varies by state. It varies by region, what the demand level is and how quickly those appointments fill up. So we want to be at that sweet spot where we're filling up every appointment as quickly as possible. But we're not having people wait for 5 hours or more trying to get an appointment.
When does the J&J shot have an impact?
Well, it's already having an impact, right? The J&J is going off the shelves like hotcakes. And, hopefully we'll have another bolus of J&J doses coming in and then steady throughout April. So we should have another, hopefully 20 million by the end of March of Johnson & Johnson. And, this is really making an impact more quickly because it's one dose and done. So you don't have to wait that 21 or 28 days to get the second dose.
Claire, I'm sure you have watched, as all of us have, the drama in the EU over the AstraZeneca vaccine. It's halted. Now the EMA says it is okay. It's safe to use. The benefits outweigh the risks. We now have Finland halting the shots for a week, reviewing 2 cases of blood clots coinciding with the vaccine. There's been talk of how all of this drama around the Astra vaccine is going to weigh on confidence, people's willingness to take the shot. How much of a problem is hesitancy still? Do you expect it to be in Europe? And then how much of a problem is it in the U.S.?
Well, I think it's the right thing to do to be cautious. And anytime you see something, that's unusual, you need to investigate it. And we have multiple safety systems at work here in the U.S. We've given 116 million doses. And so we're really watching carefully everything that happens to assure that safety of the vaccine. And I think that's really critical. I think our hesitancy is more of a wait and see. And, we're seeing that we're still vaccinating, very, very efficiently. So we have that high demand and we're really working to talk with communities, make sure that, people understand this is a safe and effective vaccine. And, hopefully, as we have more vaccine available, we just have more people willing to get vaccinated. We need everyone to get vaccinated.
Claire, how much data are you collecting as this process goes on? How much of that data is going to be useful going forward? I'm just curious as to whether or not what we're witnessing here is a step change in the digitization of the American healthcare process.
Well, we are certainly much further along than any other, vaccine campaign as far as data. It's not perfect at this point, but this is really the first time we've had states reporting data, immunization data in real time to a central place. And so this is an incredible improvement. And we now have race and ethnicity data It's not complete data. We're still working to make sure that all of the systems that are, funneling doses administered data into the system are collecting that and reporting that. So we're
Right.
only at about 60% of doses now, but it's a tremendous improvement from where we have been over the last 10 years.
Well, Claire, I'm glad you mentioned that race and ethnicity data. How much of a discrepancy are you seeing in terms of demographics and getting shots in arms? And what do you think it's attributable to? Is it just hesitancy on the part of certain populations, or are we doing something fundamentally wrong?
Well, we are doing everything we can, right? We need to make the vaccine as accessible as possible. So in addition to having these large scale, high throughput clinics, we're also getting vaccine into community health centers, into federally qualified health centers, into retail pharmacies that are in a lot more diverse neighborhoods. So we're making it accessible, and we're also doing engagement in communities, trying to listen, trying to understand, trying to make sure there's confidence and that people know the vaccine is safe and effective. But we aren't where we need to be as far as getting the doses into arms. So we've got to continue to push and make sure that we're getting Blacks, Latinos vaccinated. They are not vaccinated at as a high rate as they are in the population right now. So we need to just continue to work on that.